That's great. So let's make a start. And what we're going to do is obviously look at the Moodle first so that you are aware where the assignment brief is. Just very briefly, switching you over to Moodle for a second. So we are in the nursing course, and obviously, if you scroll down, what we're going to see is one of the units which is in a yellow border across. And this particular unit is what we've completed, wherein we've discussed the two learning outcomes. First learning outcome being, understand the policy in terms of context of health and social care services. And the second one, which is the necessary requirements that we need to be looking at to work as a health and social care professional. So what I've done is I've obviously updated the recordings here last week for both the sessions. There are in the first one, as you recall, some of you may recall that we have lots of legislation that we have to study and look at, how they impact healthcare services in general. So what I did was basically provided a lot of handouts, summary handouts for some of them, and these are some of the key acts that you need to be aware of as legislations while working within the healthcare sector. So the Equality Act, the Health and Social Care Act, the Health and Safety Act. Then we also looked at the Mental Health Care Act, the Human Rights Act, and in addition to this, there's a Data Protection Act and the overview of the CARE Act, which was updated and modified to a Health and Social Care Act of 2012. Now, in the second learning outcome, it was more focused on understanding and discovering your own eligibility to be able to work within this sector. Looking at taking that quiz, I would want to know how many of you actually went onto the NHS website and looked at the NHS roles out of the 350 roles, and then took that quiz, which was a 5-minute quiz, followed by further detailing into understanding why some of the skills, attributes, qualities, and obviously the values that you have make you suitable to work within the healthcare sector. And then within the healthcare sector, what particular role you would be more suited to take up. And that is what was actually a part and parcel of the NHS role. So if I just briefly open that, and that is where the website was. And what I suggested is that in order for you to find the most suitable and optimum career, you could look at finding the optimum career for yourself basis your values, attitude, skills, knowledge that you have, and click on this particular link. This opens up a small quiz that you need to take. And once you've done this quiz, you can view your results. And at that stage, what I'd ask you to do is take a screenshot of it, which will be useful for you to evidence the two requirements that you have to be able to work necessarily within the health and social care sector as a healthcare professional. Now, in addition to this, this particular unit, what we're going to do is basically discuss the assignment brief, which is the second document given here upon Moodle. From the top, this assignment brief is a Word document, and that is what I had initially opened up and obviously shown and shared with you, which is what we're going to discuss. The reason I provide this as a Word document is because the Word document has what is called the front cover sheet. It has your plagiarism declaration, the assignment brief, the grading criteria. And in this particular unit, obviously, this unit is not graded, but in some units, you have the grading criteria and the assessment criteria and details given in terms of how to achieve a higher grade. So this particular unit is not graded, and this is the assignment brief that you need to download, essentially from Moodle to be able to start doing the assignment. Now, for those of you who would want to look at how the assignment has to be done, there is a sample assignment which has also been uploaded, and that is a completed assignment by one of our previous students, and that is to give you an idea that how your assignment should be looking like and should be submitted with the evidence in order to pass this particular unit. So for those of you who want to look at this particular, assignment just for reference purposes, can actually look at that. And this would be giving you some sort of an idea in terms of how the assignment for this particular unit has to be compiled. Now, we will go into the details, but that is just to share what is available on Moodle, and you should be able to access this predominantly to be able to complete this particular unit. Now, let's go back to the assignment brief and discuss this in a bit more detail. So this is the Word document that you see on the screen, which I've shared. And this is something that I've downloaded from Moodle. And what we would need to do is, obviously, as we start the assignment, we write our name. We need to make sure that the sheet that you're submitting is fully filled. UK is capital, UK Versity. I do see that sometimes some of you, do end up obviously mentioning UK, but U is capital and K is small. So just make sure that, when you do, say, for example, submit the assignment, this sheet is complete. Now, what is the date on which this was set? The date on which this was set is a couple of days earlier when we started the unit. So this was set on the 3rd of January 2024. The due date for this assignment will be 2 weeks from now. So today is the 13th. So if I go back, if I go further, 2 weeks from now, first is 20th and the second will be 27th. So the due date on this assignment will be 27/01/24. The date on which you submit, you need to mention it here. There is no resubmission on this assignment because this unit is not graded. So obviously, hopefully, you guys should be able to achieve this assignment, in the first instance in terms of your first submission. And what this sheet also tells you very clearly, just as a brief startup, is that that's the name of the unit, the tutor who's taught, your name, the center name, the word count, which is up to 2,000 words for this particular assignment. And then basically, it tells you very clearly this is an ungraded unit. The credits are three credits for this unit. And these are the dates that you need to fill in. And assuming you're submitting it on the 27th or before that, then my suggestion would be mention the date on which you are actually submitting the assignment as well. Now, if it doesn't allow you to edit, I just don't think that would be the issue, because that means you haven't downloaded the Word assignment, or you do not have a Word, Microsoft Word or a software which allows you to do the edits. Now, this is something which I get asked time and again, and I think most of you as learners should have a subscription of the MS Office. If for those of you who do not have the Office, please do not use Google Docs or any other document. One of the things which I have mentioned earlier, and I will mention now as well, that you need to be able to go in and obviously download the free version of the Office, which is called the WPS Office. This is free to download. This Office is a regular version, just like the MS Office, and allows you to do everything. So for those of you who do not have, say, for example, the Microsoft Office, that is why your document here somewhere on the top, would essentially say there is no edit allowed, or essentially, because you're using a version which is, a shareware or a trial version. So on the top here, it'll have a disable, all these menus will be disabled, and it'll ask you to click or activate. So for those of you who don't have an MS Office, my suggestion would be to go and download the WPS Office. This is absolutely free, and you should use this to be able to do your assignment. I'll drop you a link, on, the WhatsApp group, so you could use this to be able to do your assignment. But these are bits I think we expect you to now know by now, because this is the 9th unit that you're doing with us, and hopefully, if you have any such questions, feel free to ask me so that they can be, obviously ironed out and discussed as we go along. Now, in other bits that you have to do, some students obviously take the instructions on board, and obviously they write most of the things. So for example, here, please make sure that you write your name. Sorry, if you don't know or have signatures, for example, soft copy of them, you can change the font like this. And then please make sure that you write the word count. So if you're submitting an assignment which is, say 2,050 words, then, or whatever the word count is, please make sure that you mention the word count as well. And these are the bits that we fill in, and this allows you to now cover, the assignment brief. Now, one of the other things which I just want to show you and obviously go through for the benefit of those who are attending, and obviously those are not able to attend will obviously catch up on the recording. One of the things now, most awarding bodies are essentially, asking us to, let's say, put into practice is primarily detection for AI, which is assignments or things which are, written to the artificial intelligence, like ChatGPT in particular, or there are lots of different tools like Perplexity, Claude, and what you would need to make sure is that the assignments that you're doing are not written using AI. Now, the reason I say this is because if you're looking at using AI, then at some stage we are scanning your documents through AI software, and that would mean that if you're caught, then we have to give you an official warning. And obviously this is something that we need to share with the awarding organization as well. So a lot of colleges and organizations like us have been asked to update their plagiarism policy. This is something that you can access on Moodle in the top of your section of the course, topmost when you get into the nursing course, and you have quality policies. So in that folder, one of the things which have been added now is primarily AI detection. So this bit is new that you would probably go in and see on Moodle. So essentially, when you look at quality policies, one of the things that you would essentially be we are asking you to be aware of, and obviously make sure that even if you use chat GPT or any such software, then you are clear that these anything that is written with the help of the AI software should have proper paraphrasing and should be properly referenced so that you are able to claim that this is your own work that you've done, and it is not work that you have actually used in terms of the software to be able to write it. So what we've done is we've provided some guidance which has come in from the awarding body, which is obviously incorporated into our policy, and that says that sometimes using AI would mean that you're duplicating or essentially using somebody else's work, and in such cases this should be um, this should not be used. Now, one of the things that I would say that you need to look at is from a point of view of the detection. We use ChatGPT's AI detection tool. So obviously, if you've used and I know that in the past some of you have used ChatGPT to write your assignments, but this is obviously something that I want you to make sure that you're not going to use going forward, because this is now an official document which obviously all awarding bodies are asking us to adhere with. And what we need to make sure is that you are aware of it and you're not using it. If you're using it to create a draft piece of work for yourself, that is fine. But at the end of the day, what you need to do is clearly reference the sources and obviously clearly reference where the material has come from. And that is where referencing towards the end of your document is very, very important. So please keep this in mind and obviously ensure that when you do your assignment, it is your own piece of original work which is submitted and not written using any of the softwares. Now, this is what you're looking at accepting, in when you fill this declaration. So you cannot come back and say that, oh, I wasn't aware of. And that is exactly the reason why we ask the learners, and you need to fill this sheet in, which is what the awarding body requirement is. Now, when we go into the assignment brief, essentially the assignment brief, which is on page 2, is only 2 tasks, and it basically talks about you have to list 2 examples of current legislation or policy guideline and briefly describe how they contribute to the health and social care provision. That's completing task LO1. And then the LO2 basically has consider the values necessary for healthcare practice and describe how your reflective practice contributes to the development of you working as a healthcare professional within the healthcare sector. Now, the assessment criteria that we've covered primarily detail out, in this grid, which is in the learning outcomes. So in learning outcome 1, we've covered legislation and how they impact the healthcare service that you deliver. And in learning outcome 2, we've covered, you first to understand and discover by doing a skills audit or some sort of an audit which allows us to understand what are the values, attitude, skills, knowledge, and ethics we have. And that is where the NHS Find a Career quiz, comes in handy, because that allows you to answer about 50 multiple choice questions, and then helps you understand that what are the qualities you have, what are the skills you have, what is the knowledge you have in this sector, and then it suggests certain types of roles. So what that quiz is essentially helping us to do at some stage is that it is helping us understand our own strengths and weakness areas, and they are being classified because we are doing this quiz specifically with the National Health Service. So they are related to understanding the values that you believe in, the attitude that you have when you come to work, what are the skills that you have because of your academic qualification or your background or experience of working within the organization, what is the knowledge that you've gained, and that could be primarily from trainings or from your previous qualification, which is academic. And then what are the various sets of ethics that you need to follow when you work as a healthcare professional within this sector? So things like, do you have empathy, do you have compassion, do you have the ability to respect others, do you have the ability to obviously maintain confidentiality, do you go and provide factual information? So some of the person-centered values, the 6 C's of the care certification, or the 6 C's of health and social care, and the NHS values are basically asked in terms of questions that you answer, that do you believe in this value or do you have this value, and there is an indirect way of checking where the quiz is being taken, and then the questions being asked are checking with you in terms of some sort of wording, that whether you have these ethics, whether you have these values, whether you have these skills. And that is why that quiz, and completing that quiz is important, because you can use that quiz result of that quiz as a screenshot to show that I have done an audit, and what I've done basis the audit is identified the two essential requirements for me to work as a healthcare professional. And these two identified requirements could be any of these, from any of these two from the five which have been listed, that we have covered, and that would be quite directly helpful to you to put as evidence in the assignment. And then what they're asking to do in this case is to compare and contrast. That means any two values that we pick out, say, for example, I pick out skills and knowledge, then I would also need to have a table in the assignment which will compare and contrast the merits of these two requirements that I have, and how they meet the working requirements of me as an individual within the healthcare sector. So this is going to be important. You could do this as a table, you could do this as two separate paragraphs, but basically the task is to compare and contrast. One is to discover what values, what are the various things that you have, which is two out of these five, and that would be done through the quiz. But once you've known that these are the two main values or skills or attributes or ethics, or say, for example, at let's say knowledge I have, then you would need to compare and contrast that, so that it allows you to complete this particular part of the task. And then the second part is basically the reflection on what you have discovered and how you would go about improving it. And now that you know that these are your values, ethics, knowledge, skills, and attitude which are required, how would you go about improving yourself, or gaining some of these, or let's say sharpening some of these skills or things which are required for you to work successfully within this sector as a health and social care professional. So that's the bit which is the tasks that we have to cover. And broadly speaking, these are the two that we would need to write when we start an assignment. So if I copy these for a minute and then go down, obviously this is where we will be putting the commenting when the assignment is submitted. What I would do in this case is go to the end of the document, go to insert, and go and do a page break. That means I will insert a new blank page. And obviously here, what I'm going to do is assignment, and then I will write the two tasks. So basically what I'm going to do is enter and create some space here. and then, assignment, and then the word count. So these could be the two broad headings that I normally put in here. Sometimes you can also put your name, and that although you put it across, but just to give it a bit of a shape, you normally put that in as a bit here, and then you write the two tasks, and then we know that the word limit for the assignment is up to 2000 words if I scroll back. So what you're looking at doing is roughly assuming that we are writing about 1000 words here and about 1000 words here. So that should allow you to essentially complete some part of the assignment tasks in a way that they are balanced, they are complete, and obviously, meeting the criteria. Now, I know in this that there are these bits that I need to cover. So one of the things that I will do is obviously look at the two legislations that I can explain and relate to. Now, if I know that some of you are working, so there are these legislations that we talked about in terms of the first learning outcome, and these legislations that we talked about, included the, say, for example, the Equality Act, the Health and Social Care Act, the Mental Health Act, you had the Data Protection Act. There were other Health and Safety Act. There were I think 8 or 9 different acts that we have covered. Now, whatever two that you choose, that you are comfortable with, that you can explain with examples, are the ones that I would suggest that you follow through and write in the assignment. So in this context, so if I have to start, for example, I'll give a bit of an introduction to start this, and I'll say, for example, in the context of healthcare provision, because obviously this particular unit that we are studying is primarily, introduction to professional healthcare service. So we are going to be talking about a bit of an introduction. So just to say that in the context of healthcare provision in the UK, or if you're being very specific, say in England and Wales, there are many pertinent pieces of legislation and policy guidelines which are required to be followed within health and social care. I'm writing this as I'm going to write. So I'm going to discuss two of these as below. So number one, for example, I am going to choose two which I think are, quite meaty, and I can actually discuss and talk about them in a bit more detail. Some of them, like the Health and Equality Act, or so, for example, the Equalities Act, the Data Discrimination Act. You look at Data Protection Act. You look at, for example, Human Rights Act. They are good acts and obviously legislations that we need to be aware of. But to a certain extent, I feel that they might be as obviously we are expected to know because it's a part of the indicative content in the unit. But I would want to be more specific and choose acts which are directly related to health and social care. And obviously, they would allow me to bring in some working examples because I'm working within this sector and I can relate to it. Because at the end of the day, if I look at the assignment task, it is asking me to start with describing it, but also include two examples. So, in order for me to be able to show and evidence that this is what the acts are or legislations are, and these are the examples, I think my suggestion on that side would be to choose something which you can actually justify. And obviously, there's lots of information available that you can relate to, and then bring it out as evidence in the write up for your assignment. So, in this case, I've chosen the Health and Social Care Act. And then the other thing that I will choose is the Mental Health Capacity Act of 2008. Now, these two in particular can be described in detail. There is a document, both the acts. There is a detailed document that I provided. If I have to go about writing and obviously including two examples, what I would do is basically go through those handouts, uh, summarize them in my own words, and I'm looking at writing about, say, 200 words for each of these acts with an example, and then 200 for the other, that would allow me to complete this particular task, comprehensively, without, any sort of, borderline areas. So what I would do is go through those two acts that I've given as handouts, and then read them thoroughly, and then basically summarize the key points of it in these acts. And then towards the end, what I would want to do is basically add an example. So that would help you cover, them, because what it says is, describe, one is the first part, you have to cover two legislations, so you have covered two of them. Then it says briefly describe how these contribute to healthcare provision. So when you read these handouts, and obviously how they are enacted in the NHS in England and Wales, and explaining that would basically show how they contribute to the provision of health and social care services, or basically in the, say, for example, delivery of these services to the members of public. So one of the features, if you recall, when we covered this particular act, was that the Health and Social Care Act was actually, created in 2012, wherein the main reasons of the creation of this act was the establishment of what is called the CCGs, the clinical commissioning groups, which were made responsible for planning and commissioning of healthcare services in a local area. So they work very closely with the local authority, the setup, which is hospitals and surgeries, to be able to allocate budgets and then provide these services to the members of public. So this decentralization was intended to ensure that services were more tailored to the needs of local population. And when this act was introduced, it also looked at enhancing the quality of healthcare, including the development of what is called the NHS outcome frameworks. So this focuses on outcomes as against, just improvements, plus the powers being given to the CCGs, which meant that they were responsible for planning and commissioning of healthcare services in a particular area, was the significant, contribution, or let's say the significant impact that it had in bettering, or in better providing these. When I say these, what I mean by that is been better providing healthcare services to the members of public. Now, one of the main things of this particular act, or the framework, was that healthcare provisioning was, the provisioning of health and social care was actually emphasizing on patient-centered care, and that is where the patient-centered values come in, or PCA as we call it. And this focused on outcomes and obviously the efficiency of delivery of these services to members of public in a particular area. So you don't need to wait. For example, the CCGs are directly responsible for ensuring that you don't have to wait long hours, or many days to be able to meet your GP within the surgery. So this is something which is decided by the CCG, and the commissioning of this particular act was done primarily to create the CCGs, which will drive, the let's say the provisioning of these services, including planning and commissioning in a particular area, and that provides greater autonomy and accountability to people who deliver and manage these services to members of public in Manchester, say for example, in a particular area. So if I look at Manchester, I'm registered with a particular surgery in, say, Didsbury, and one of the things which the trust which manages some of these surgeries in South Manchester would essentially be looking and working directly with the clinical commissioning group based under the Greater Manchester Combined Authority, and they would then be looking into planning, commissioning of these services through pharmacies, through surgeries, through hospitals. So, for example, within Shaw, Manchester Infirmary, Greater Manchester Northern, and these hospitals would then be looking at providing additional services to patients when they require, say, for example, clinical operations or care, or procedures which have to be carried out in hospitals. But this referral of that happens from the surgery, and that becomes the initiating point. So there is a lot of autonomy now available because of this particular act, and the giving and including an example of that would essentially help cover this particular task. So when you write this out comprehensively in about 200 words here and 200 words here, and then obviously how this legislation essentially, you know, I would say helps in or contributes in providing better healthcare provision with the use of examples would allow you to complete this task comprehensively. Any questions on this so far?
Okay, so so with the explanation, does it mean that if you explain it, then you have to add some examples, right?
That is correct, yes. So, because the first part would be you will cover the two acts and explain and describe the two acts. And then the other bit, which is to show the how they are relevant in the healthcare provision, you are going to add two examples which are related to the two acts or legislations that you're going to cover in this task. So if you cover Health and Social Care Act, maybe add an example for that. If you cover Mental Health Capacity Act, add an example for that. But if you choose any other act, for example, Equalities Act, Human Right Act, then you need to include examples related to those acts, and that is how this will help in description of that particular task.
Okay, so the example, can you give more than two, or it should be two examples?
Well, minimum two is what is
Okay,
required. You can give more than two also, not a problem, because there is no negatives or points, or in this case,
yeah.
because the unit is not graded, so it will not penalize you for giving more examples. But yes, you can give more than two examples as well.
Okay, thank you.
No worries. Anybody, any other questions? Okay. So in, say, for example, the reason I've chosen, in terms of examples, if I put it across, for the Health and Social Care Act, if I choose that act, what I'm going to do is basically talk about, say, for example, in this particular act, some of the key requirements which are useful, for this act to be able to check that whether they are being followed, whether they have been implemented within a particular setup. They would include things like well-being. They would look at person-centered care. They would look at when I talk about person-centered care, so I'm looking at care which is tailored to meet the requirements of the patient. It provides autonomy, independence, respect, dignity, and the ability to be able to show empathy and compassion. And those are the values that are going to be used as an example to show that how this act essentially helps deliver, for example, services. Now, the actual example that I might end up taking would be saying that somebody as an elderly has come in and has been admitted to the hospital, and they are, say, for example, undergoing hip surgery. Then in those cases, the act is implemented to ensure that one, before the operation happens or the procedure happens, the patient and patient's family are fully briefed on the requirements, the pros, the cons, and obviously if there are any areas which would not be, say, for example, which could be areas which are, areas in which the family or the patient could have patients and questions essentially, and that would be answered by the staff. Then once the surgery happens, obviously the focus is on the well-being of the patient. The focus is on essentially preventing any, or let me put it this way, the focus is essentially on ensuring that the patient is quickly or promptly, getting well and obviously being released from the hospital. And at some stage, the care which is going to be provided or aftercare which is going to be provided to the patient at their house through social care workers would be personalized and bespoke to helping the patient get back on their feet to be able to do their daily chores and obviously become just start doing things that they do on a normal routine over a span of their time, which is going to be, say, recommended in the recovery time or the time required after the operation by the patient to become absolutely functional and independent to be able to carry out functions themselves or without the support. So here, the healthcare providers, which is the local authority, the social workers, the hospital, maybe the nurses, they will be required to work with local authorities and maybe in some cases, some care agencies to ensure that the individual receives the high quality of care, and that care is tailored to meet the individual needs, but also is allowing the patient to recover and then become independent to be able to do most of the functions, or go get back to a daily routine which they were doing pre-surgery, in as soon as or in as shortest time possible. So this could be an example. On the Mental Health Capacity Act, I might take up an example of an individual which is, say, for example, a person which is disabled or is mentally disabled, and in this case, the decision-making power on certain aspects of it is being transferred or is resting with the family members or one particular person within the family, and then the person who is chosen to be able to make those decisions is aware of the mental health act or the health capacity act, so that the decisions which the person takes are in the favor and benefit of or the interest of essentially the patient. So in such cases, what tends to happen is that the court appoints a particular person, giving them powers to be able to make those decisions, but the person being given those powers to be able to make those decisions on behalf of the patient, because the patient does not have the mental capacity to make those decisions themselves, has to follow a legal framework, and that legal framework has to be adhered to ensure that no decision making is done which will compromise the care and treatment the patient actually receives from the local authorities. So the Mental Health Capacity Act, or MCA as we call it, will obviously, has a long lasting impact, specifically when individuals, are not able to make those decisions. And these decisions are made on behalf of them by members of family or somebody who's authorized to do so. And in such cases, when we look at these decision making parameters, they would be, making sure that these are in the best interest of the patient. There is a proper consultation and involvement, of before these decisions are taken with relevant members. It could be local authorities, it could be friends, family members, it could be people who have relevant information or can provide relevant information regarding the patient's health and the mental capacity. And in some cases, independent mental advocacy, mental capacity advocacy people are also involved. That means people who are trained in this particular area, and they advocate the best interests of the patients, if they are incapacitated to be able to make decisions. So these bits would be examples that you would need to add. And one such case that I normally look at is when we look at end of life, situations wherein, patients are treated as or declared as being terminally ill, and they do not have the capacity to be able to make decisions. So in this case, what tends to happen is that an advocate or a mental health capacity advocacy person is appointed. This person would do consultations with the family members, the friends, maybe people involved in providing the care, and then a decision would be taken to ensure that whether life-sustaining treatment has to be carried out, or care and treatment needs to continue when patients are terminally ill. So in such cases, these would be termed as examples that you will need to take specifically for the purposes of discussing, the two acts that you pick out. And sometimes people find it easy to talk about the Human Rights Act, the Equality Act, and then you are able to, obviously relate it with an example. But generally speaking, whichever one you are comfortable with, I would suggest you pick that up and then obviously, discuss that in a bit more detail to cover the task. Now, in the second, task that we are looking at is wherein we are essentially looking at doing that audit, which is talking about the skills that you need to have as a healthcare professional. And what I would do essentially in this case would be to, start with, if I have to start doing this particular task, what I'm going to do is basically talk about two areas in particular. One would be what is reflective practice. because this is directly related to one of the assessment criteria. So I will give a bit of an introduction about reflective practice, which is one of the key things this task is asking to talk about, which is consider the values necessary for healthcare practice and describe reflective practice and how it contributes to the development of you as a healthcare professional. So one of the things I'm going to talk about is the reflective practice. The other bit that I'm going to talk about is the values which are necessary to provide healthcare and practice healthcare or deliver services of healthcare as a healthcare professional. So here I'm going to be focused on healthcare practice and basically talk about in this skills that I have, and that is where the screenshot of your the quiz can come in, and then we describe what is reflective practice, why it is important, and how it helps in actually contributing you becoming a better person and delivering healthcare services to patients in the setup that you work in. So, reflective practice, if I have to describe, as I mentioned to you earlier, is a process, or it's basically essential within the healthcare sector, because it actually nurtures the core values of you being made aware of, say, you being self-aware of essentially, and you are encouraged to then follow ethical practices which would allow continuous learning to happen, which would allow adaptation to happen in certain circumstances of your skills, of the values, and obviously the knowledge that you have, and thereby it will enhance in how you deliver care to the patient. So sometimes when we say we do this, we do a task, and then, if we are given an opportunity to do that task again, because we have done it now and we've experienced it, sometimes what you're able to do is basically bring across improvements in terms of how you would perform that task again, now that you know that these were the drawbacks or the challenges that you faced. And this bit of adapting of how you deliver and adapt in a situation like that to be able to do the task well second time round would be because of the reflection you are able to do on how and what things, how things went well, what things did not go well, or what were the things that you forgot, or what were the things that actually went wrong when you were doing the task the first time. So here is where you could include a bit of theory by looking at covering what are called what we discovered is a theoretical framework which is called the Klob's cycle, which had the 6 steps that you go through. You could cover this task by briefly mentioning in 30 to 50 words, by putting in a picture of the Klopp cycle or a diagram of the various 6 steps in the Klopp cycle, and describing it in 30 to 50 words. That obviously David Klopp brought across this particular process of how people look at, with a bit of hindsight, if they had the opportunity, then now what they know, they would have done the task differently, and that process of reflection or adaptation, can be linked to the Klopp's cycle. And this reflective approach, would ensure that and then what I would suggest is that this reflective approach you apply to you as a healthcare professional. And how does it help you become, say, for example, more responsive, more competent, more compassionate, or, overall, how does it contribute to you essentially, say, let's say, effectively delivering quality services to patients, or people when you're working as a healthcare professional. So that would be the bit on reflective practice. And when we look at some of the values, so for example here, because if you recall there were 5 in particular, so I could pick out values and skills, or I could pick out values, skills, or knowledge, or I could pick out any 2 or 3 of them, and this could be ethics, for example, and or attitude. These are the 5 which are there, if you recall from the indicative content. But I would pick out, say, 1 or 2, and I could find this to be easy at my end if I talk about the values and skills which are required to work as a healthcare professional. So I would talk about values like empathy. I could talk about values like integrity. I could talk about professionalism. I could talk about compassion, or I could talk about, say, for example, patient-centered care. I could talk about, also showing dignity towards patients, and so any such values which are related to the 6 C's of healthcare or person-centered values could be covered, and that would allow you to comprehensively cover some of the values necessary, to start working as a healthcare professional, basically providing healthcare practice. When you work within a setup, and you are needing to have these values to be able to effectively work as a healthcare professional. So this bit would help you cover, the first part. But let's not forget that one of the things in the assignment, detailing of the assignment, is to look at comparing and contrasting the merits, or the values that you're going to discuss. So that bit has to be essentially done in this particular task after you've described these values. So comparing, and contrasting. So that means what you need to be doing is essentially looking at, comparing and contrasting any two of these values, which means you're basically talking about what are the similarities and what are the differences, or what are the areas through which you are able to, show that, say, for example, if I compare one of the, skills which I'm looking at is, within this particular aspect, is I would talk about, so here I would say skills, and I would say in this case, say critical thinking and reasoning is one of the skills. I would also look at, say, problem solving skills, so problem solving skills. I would also look at, say, decision making skills. So these are skills that you have because of your experience, because of the knowledge that you have worked, or your prior experience of working within this sector. And you could look at, other skills that you could mention, primarily in this, let's say, in this particular task. Now, when I look at comparing and contrasting some of these skills, I would need to, essentially look at, comparing these two from a point of view, their advantages and how they contribute for me becoming a better healthcare professional. So here I might insert, if you prefer, you might insert a table, and you might discuss. So, for example, here I might discuss, compare and contrast. So here I might discuss some of the skills that I've got. And in this table, what I would do is basically look at, mentioning that how I'm comparing and contrasting by looking at discussing in this table. So when you press enter, what you'll be able to do is write a couple of points here, and they would help meet this particular, criteria. And then when you have done this and you go into reflective practice, as I mentioned, you discuss a bit about the theory, which is the Klopp's cycle, and how then it helps you to look at improving the services that you deliver as a healthcare professional. How do you develop yourself as a healthcare professional? So here, one would be that your reflective practice actually helps you in professional development. That means you are growing as a person in terms of, gaining more experience, more knowledge, and obviously developing more skills. And these skills, along with the knowledge that you gain because of the work that you do with other colleagues, allows you to better your understanding about a particular field or an area that you work in within the healthcare sector as a healthcare professional, and that allows you to provide more professional and efficient services to your patient. Then you could also put out points that it helps to identify, when you do reflection, identify the areas, for improvement. What could be the areas that, you need to improve? When you look at with a bit of hindsight, that these are things that I do well, these are things I don't do well as against, and when comparing myself with other colleagues, or these are areas in which I do not have any knowledge, or these are areas that I'm not aware of, then it helps you to discover this, and then you put a plan in place which helps you identify. One first part would be the identification, but after the identification, it allows you to put a plan in place to be able to develop some of these skills, and that is where it is going to help you as a professional to become better, and that is the whole purpose of reflection. You can also include points like accountability. So when I look at accountability, what I mean by that here is that when sometimes I look at reflection, I look at how did I do when I compare myself with the standards that I had to adhere to, or the policy or the legislation that I had to comply with. Did I meet the requirements? Did I, understand what was required, and did I deliver or act on the basis of that requirement? So you can look at checking whether you are self-aware of those responsibilities, and then on those responsibilities how you did, and that would be looking at professional accountability. Now, one of the other things that you would look at when you give an example of accountability would be that if you were seeing something wrong happening, or if you were seeing something not which is supposed to happen as per the process but not happening as per the process, so what you're looking at is you're accountable because you work within that particular setup, and it is your responsibility to bring it to the notice of your manager or your supervisor, and that would show that you have accountability and understanding of that this is an area wherein standards cannot slip, and people who are relevant to that particular standard, or maintaining that standard within the setup, like a hospital or a surgery or a pharmacy, or a community center, they need to be made aware. And in those cases, you're holding, or by bringing this let's say inefficiency, or let's say inconsistency to the, let's say, I'm wanting to use the right word, to the knowledge of your supervisor or your manager, is basically holding them accountable, or in such cases holding and doing your part to make things accountable within the organization. And that would be useful because it will allow the standards and the quality standards not to slip, providing the due amount of care which is required, and thereby in some cases even reducing fatalities. Because if care in important areas slips and the standards are not met, then it can lead to a loss of life or fatalities. And that would be also looking at ensuring that you are able to inform the relevant people, authorities, managers, supervisors in time, to ensure that they are accountable, and obviously the standards do not slip. So this part would then help you cover the reflective practice part of it, which is in the part 2 of your assignment. Any questions on this so far? Any questions, anybody? Right. So if there are no questions, my suggestion would be to also look at the sample assignment, which is there up on Moodle, and then obviously go through some of the slides and the handouts which are provided before attempting the task, so that you are providing or creating evidence which is directly related to the task given in the assignment brief, and thereby there is no digression, but you are being relevant with regards to what is required for the completion of the evidence, and the compilation of the assignment. Now, assignment needs to be submitted to the email address, which is, so where do you do your submissions? Submissions are done to LearnerWork. So when you do submit the assignment, please make sure that you're not submitting the assignment through OneDrive or Share Drive, or, just make sure it is a simple Word attachment. You need to download the Word document. If you use cloud services, then please download the Word document and then email it across to this particular email address, so that I'm able to pick it up and I can assess, and then obviously give you feedback to say whether you've managed a comfortable pass in the assignment. If in some cases, if I do feel that certain areas are short, or maybe the assignment you need to rework or amend, then the feedback would be given accordingly, so that you're able to make the changes and then do a submission to be able to complete this unit. So that is all for today's session, and I hope you have been able to understand how the assignment has to be done and submitted. We will be looking at starting a new unit tomorrow. That unit is, I think, social and welfare, social and I think that unit is called the Social and Welfare Community Provision, and that unit also has 2 learning outcomes. So we'll be looking at starting the new unit with an introduction tomorrow, and then next week would be looking at covering learning outcome 2, and on Sunday the assignment discussion, which will also complete that particular unit. So that unit on Moodle is Social and Community Welfare Provision. I'll very briefly show that to you so that you're aware, and I will see you tomorrow in that particular session. So this is the unit that will be starting tomorrow, which is...
Excuse me,
Yeah,
please.
go on.
Are we starting another topic tomorrow?
Yes, the new unit will start tomorrow because this unit that we have done today has been completed, which is Introduction to Professional Health.
Can we now have the grace of tomorrow and start another one for next week so we can go through this properly and prepare to start our assignments? It's just a suggestion. I did say
No, that's
we should
fine.
not.
That's perfectly okay. I think the way that we have done the scheduling is because if we start that unit tomorrow, then we will have learning outcome 1, and then the next week we'll be able to cover learning outcome 2 on Saturday, and then the assignment discussion on Sunday. That will allow us to finish the unit, and then
Because I was just thinking that, if we have tomorrow as in to go through, that means we have a full 2 weeks. Like we started this last week and we finished this week, then we can start another one fresh next week. So it won't be like coming in between, confusing and all that. It's just my opinion, but I did say it should not be so.
no, that's perfectly okay. I think what I would suggest is, on the WhatsApp group, I think there are 6 of you today in the session, or 5 of you in the session today. So, we could do a quick, everybody could quickly put some comments in, and if we have majority of them saying no, and let's do next week,
Okay.
we will postpone and reschedule everything for next week. But if some of them still say, let's continue and complete that unit,
Yeah,
so we'll do
continue.
that
Yeah,
session. So
that's
we'll take it that way. Let's do a bit of a
fine.
democratic,
Yeah,
decision.
I agree with her. I agree with her.
Yeah, because it's
Yeah.
No, that's perfect. That's absolutely fine with me. I'm not in any rush. So as long as we get, most of you, consensus with most of you saying, yeah, that's fine, then we can look at starting next week. Not an issue at all.
all right. Thank you.
Okay, thank you. Thanks for attending, and I'll see you,
Thank you. All
hopefully
right.
see you tomorrow or next week, but depending on, quickly comment where everyone is so that we can decide, and I'll put a message down, and so there are no surprises that, we are having a session tomorrow or not.
All right. Thank you.
Okay, take care. Thanks for attending, and bye for now.
Bye.